Unified City TV presents Health Matters. We bring you education and awareness on your health, the total person, your spiritual health, your physical health, and your financial health. Please join us, faith leaders, professionals, and community leaders, this Thursday and every Thursday at 6 p.m. CST or 11 p.m. GMT for a life-changing encounter. Your health matters.
This place right now. Believe it. Believe it. Believe it. Believe it. Hello and welcome to another edition of Health Matters. Today, we will be bringing to you another health condition that is very, very prevalent in our community. And all of us have some way, somehow heard about the condition we call hypertension. But most of the time we just say high blood pressure, high blood pressure, high blood pressure. But today we will be discussing high blood pressure. So wherever you are, I want you to share the video and I want you to stay tuned because there are lots of information that we have for you today. I want you to know that the information we give here, the education that is presented to you, it's for you to take the information and prepare yourself and see your primary care doctor or see a doctor, whatever condition you are facing. You have to do your follow-up with your primary care doctor or your primary care physician. So we are not telling you to self-medicate. No, we are just giving you the information so you can know the symptoms, so you can be properly, knowledgeable about what is going on in your body, and then you can seek help. You can ask for help. Having said that, I also want you to be aware that we are not out of the woods yet. COVID-19 is still around. You need to keep your family safe. You need to keep your community safe. So if you have not taken the COVID-19 vaccine, I will encourage you to do so. And also, the vaccine is also being administered to ages 12 and, above. And if you have an underlying health condition, I want you to know that it is important that you speak with your primary care physician and whatever recommendation he or she makes, you need to pay attention and you need to do that. Also, there's booster shots that are available, especially for people with underlying health conditions. So tonight, we will be talking about high blood pressure. And I want to introduce my presenter tonight. She's not a guest anymore. She's part of this program. She's not a guest. So Selma is here tonight to talk to us about high blood pressure. All you need to know, almost all you need to know about high blood pressure. So Selma, you are welcome. You are welcome. You can introduce yourself before we go into it.
All right. Thank you very much, Pastor Blake. It's a pleasure being on your show. And I hope the information we gave tonight and gathered tonight, we will use it and help with our own selves and present these things also to our primary care providers. Thank you again for inviting me. I've been a nurse practitioner for less than a year, but I pretty much am in a clinic. I'm running solo, so most of the things I do it. You know, sometimes I have to. You gotta go work alone. However, this is where we are. I want to say I greet you all in the name of Jesus. I want to say thank you to you all for watching this. Program tonight is a wonderful topic about high blood pressure. But I also want to let you all know that this month, October, is Breast Cancer Awareness Month. And I'm asking all our women out there, our mothers, some daughters, all the women who are, if you have a risk factor for a breast cancer, your mother, your grandmother, your auntie, your sister. So this is the time you need to go and have your mammogram. If you cannot, I know during the pandemic, a lot of us have put off our, basic screenings, as the mammogram and, colonoscopy and those kinds of things. But it's time now, things are opening up. It's time to make your appointment with your primary care doctor. If you don't have access to getting a mammogram, women, you can do the self-breast exam that we encourage you to do every month on your breast, both breasts, preferably during your shower time or your bathing time. Check your breast and, check it. You can check YouTube for ways to how to check your breast for any lumps or any cysts or anything like that. So I'm just letting you know that this month is Breast Cancer Awareness Month. So I'll say let's go into our topic of hypertension.
Thank you so much. Thank you, Selma. But the this condition is so, it's all over the place. But I guess most of us don't have the information that we need, because some people just think that we're supposed to have, it's, I don't want to jump the boat. Let me now go ahead of you.
No, go ahead. Go ahead.
So, some people, people just think that there's some, they're supposed to have some symptoms before you even have high blood pressure. But I've come to find out that it can just be like this. Just, just in the twinkle of an eye, just how rapture is going to take place. In the twinkle of an eye, you can just have an attack. You can have, that kind of a condition, and you find yourself in a place where you least expect. So we need to take this seriously. We need to take this. This is one topic that we will be coming back again. Maybe today might not be enough. Even if today is enough, we will come back, because this is something that we have to keep harmony. We have to keep nailing it on the head, so people can get to understand that this is serious, especially because of the kind of food we eat, where we come from. We are so used to citing kind of food, the way it's supposed to taste and the way things supposed to look. So we need to pay keen attention to this discussion tonight. So having said that, what is hypertension?
Okay.
What is high blood pressure?
High blood pressure is basically the pressure that your heart is moving against, in a nutshell, every minute. And the normal blood pressure is 120/80. That is the normal pressure that's in your aorta, in your aorta in a minute. So every time that pressure is going up or down is how much pressure that aorta is going against. So we define normal blood pressure has anything at least 120/80. That's a normal blood pressure. If you have something between, and blood pressure can be defined, they have different associations, like the American Heart Association have a different guideline for blood pressure. The American Cardiology Association has a different definition of how to define blood pressure and pre-hypertensive blood pressure. So they have pre-hypertension with anything between 120 to 139. And that's your systolic blood pressure. That's your top number. And then you have diastolic blood pressure, anything between 80 and 89. That's called pre-hypertension. This is where you want to really grab all your thing and put yourself together, because if you don't get this treated, it can go forward and it can lead to a lot of things. So basically, is pre-hypertension is the pressure that's being forced from the left ventricles, that the pressure is being forced against throughout the body. So basically, that's what hypertension is. And
I realized that we have types. Until I went into my research, I didn't know they had types of high blood pressure.
Okay.
So tonight, tell us, what are the types?
So hypertensions have various types. You have the stage 1 high blood pressure. And again, like I said, different organizations have their numbers can be different. So it varies. But systolic blood pressure, anything between 130 and 139 systolic, or 80 to 89, that is considered a stage 1 blood pressure, stage one hypertension. And like it depends on different guidelines from different organizations. And then you have stage 2 blood pressure. You have a blood pressure between 140 to 90, and that will be considered stage 2 high blood pressure. And then again, like some people will say, is 160, anything greater than 160 systolic blood pressure, or anything greater than 100 for diastolic blood pressure. You also have the malignant blood pressure. These are potentially life-threatening blood pressure. These are blood pressures that are very high, and they need to be treated right away because they are life-threatening. You also have the hypertensive emergencies. These are your life-threatening ones. These blood pressures need to be lower so that they don't affect your eyes, affect your heart, and affect your kidneys. Even though we'll go through all the things here, even though blood pressure can affect your kidneys, but these hypertensive or emergencies really have they can do significant damage to your kidneys. So these are some of the type of hypertension. You also have, it can be also classified as primary or secondary. So primary hypertension is one that you can get from the environment or your genetics. And that one is about at least 90 to 95% of the population have the essential or primary hypertension. And then you have the secondary hypertension, which can be caused by like your endocrine system, your vascular system. And those are, the numbers can be anywhere population between 2 to 10% of the people. So primary hypertension, essential, or some people call it essential hypertension. These can be caused, like one of the number one causes for that is called the sympathetic hypersensitivity. So your epinephrines, your norepinephrines, those are hormones and neurotransmitters also that can be involved, that can cause you to be in a hypertensive state sometimes. You also have, and then because you have these, they can cause your vessels to constrict. And when your vessels, not vessels, your vessels to constrict, it can cause you to increase the pressure in aorta, and that's what cause hypertension. That's one of the causes. The other cause also can be from environmental causes, can be from, I think I just said that also, and then genetics. Genetics also can be like a lot of African American, Black people, do have this decreased salt excretion. That means we hold on to salt in our bodies. It don't excrete in the urine. So when we hold on to salt, the salt buildup, and it causes a lot of vasoconstriction, and then it causes the pressure to be high. Because when you have vasoconstriction, it causes more pressure that the blood has to push against. So that's one of the causes for genetics. And also for secondary cause, that's one of the causes too.
Thelma,
And
before you go on, I just want us to go over that environmental, you know, again,
okay.
because yeah.
So the environmental also, I said, is the epinephrine and the norepinephrine. Those are hormones that are in the body, and then when you're in this hyperactive state, you have this sympathetic nervous system that's bringing out these hormones, and
Mhm.
these hormones cause vasoconstriction. It's kind of way to protect the body. However,
Okay.
they do raise the blood pressure. So
Oh,
that's one of the mechanisms to which that we can have high blood pressure. Through this, it's called the let me get the right thing here, hypertensive sympathetic nervous system. So that's why it causes vasoconstriction by releasing these epinephrine and norepinephrines, and it causes the peripheral vascular bed to have higher pressure. And when you have that vasoconstriction, high pressure, it causes the blood pressure to be raised up.
thank you.
And oh, yeah, okay. And then secondary
Yeah.
hypertension. This is the one that's usually caused by an actual somehow disease related. Like for instance, the endocrine would be your thyroid. If you have too much thyroid hormones coming out, it can also cause the blood pressure to be raised also. And if you have um, for the renal vascular, if you have problem with your kidneys, again, it's called this aldosterone. Aldosterone, when you release aldosterone, it causes regulation of salt. So you have increased salt in the body. The body is not bringing out the salt. It can hold on to that increased pressure because, again, it does cause vasoconstriction. So all of that will help the pressure to come up. So that's why we have this high blood pressure problems.
Thank you so much. There's so much to,
Yes,
yeah.
it's a lot on high blood pressure.
BP that needs to be corrected in 24 hours.
Okay, so this one is your one of the hyper tensive urgencies. These are blood pressure that needs to be corrected in an hour. So if you do your blood pressure and it come up and it's very high, you need to either find yourself in an emergency room or you need to take your medications, because sometimes these things, even at home, when it's very hard to control them. So you have to be, if you haven't had any symptoms yet, because sometimes these things can cause other problems that you will be not in the right way to call for emergency help. So that's why it's good. We always say to get a good control of your blood pressure. But a lot of times, unfortunately, when we see people is in these crises here in urgent hypertensive urgencies, that it need to be corrected. So time is of essence. If you don't correct these, you may have serious problem.
So how do you diagnose?
So how do you diagnose blood pressure?
Mhm.
Blood pressure is like one of the most common diagnoses in the US and worldwide. So it's not just in the US, it's all over the world with high blood pressure. We do physical exam with that. And to diagnose someone with high blood pressure, you have to have blood pressure has to be done twice. Let's say a patient comes in today and they have a high blood pressure. Okay, maybe they're kind of nervous, they're in a hospital or they're in a doctor's office, they're kind of nervous and they're anxious, so their blood pressure will be high. We check it again in two different arms. Okay, it's still high. We do that. And then we also do labs. We do labs such as, like the chemistry to see how the kidneys are doing, to see if they're putting out protein in the urine or any other things that usually shouldn't be in the urine. We
Mm-hmm.
check that also. We check to see how the kidneys are doing, because the kidneys pretty much tell how much you are excreting out of your body. So we do all those levels down. We also do an ECG, or the EKG. Some people say EKG, some people say EKG. We also do that to look at, like just to check to see what the EKG look like. A lot of times when you see these, you see people with enlarged, like we call it, hypertrophy. You will see that on the EKG. Or even this is like worst scenario, doing like the MRA or the ultrasound. You usually don't get to that because those are very costly. So you try to do like the basic first thing. You do the physical exam, you do the lab, you do the EKG, and you kind of reserve the MRA for later.
Yeah.
So when you like I said, when you want to diagnose someone with this, if they have a elevated blood pressure in the office or at home, you want to give them like a home monitoring system. You want to say, okay, since your blood pressure is high, let's take this approach and go ahead and send you home with a home monitoring device. That means the person will have to do their blood pressure every day and see how they do. If those blood pressures are high at home, and so and they come back, and after doing that, you look at it and say, "Oh, you know what? You do have high blood pressure. It's not just in the office." That's when you pretty much diagnose someone with high blood pressure.
Okay. Before we continue, I want us to check the screen here. We have for comments and for questions, you can call our number. WhatsApp, if you're in Africa, you can call our WhatsApp number. Even if you're here in the States, it's 952-201-9287. So for questions, for comments, our number is on the screen, 952-201-9287. And you can call us on WhatsApp to make your contribution. Thank you. Someone, we go back to you. There are some people, it, it's good that, we talk about how it is diagnosed, because some people will just touch the back of their head and, they'll say, oh, my head has been pinning me from the back. And I've been feeling tired, my neck and everything. So I think I got high blood pressure.
Okay. So high blood pressure, like it's called a silent killer,
Mm-hmm.
because a lot of times we don't know we have high blood pressure until it's really bad. Some people will have the headaches. So sometimes you may have high blood pressure, you have the headaches, you have the vision problems, the double vision, the blurry vision. Some people even lose their vision. A lot of times you don't really know that you have high blood pressure until you go see the doctor. So a lot of times you see, and which is kind of sad, you will see that before you know, you like I tell people, they come and say, oh, I don't have high blood pressure. I'm like, listen, you've been here 2, 3 times already. Your blood pressure is high, and it's high. And they said, well, I didn't know I have blood pressure. I said, well, a lot of times we don't know, unfortunately, until we have a stroke.
That's right.
Until you have a stroke and you're in a hospital bed is when you know you have high blood pressure. So high blood pressure, that's why they call it a silent killer, because a lot of times you don't know that you have high blood pressure. And then and it's not just the high blood pressure. Sometimes when you have high blood pressure and it's really not controlled, and I'm speaking for people who do not know they have high blood pressure. If you see your face getting puffy, you see your hands getting puffy, your legs getting puffy, that's a sign that you are not well. And a lot of times people have a problem because when the pressure is overlooked for so long, it will get into that, but it turned out to be
Yeah.
other problems too, that you can't really breathe. So it's not always just the headaches, it goes over the whole body. So is the headaches, the vision problems, the swelling in the hands or the feet, the sometimes difficulty breathing because you have so much water in your body and it's not coming out. So you are kind of fluid overload, like we call it. So yes,
And
it's
then
the
we want to look at the causes.
okay. So prime, I have your causes. Some of the causes that can be with high blood pressure, you have the essential primary high blood pressure. Those are the ones we talked about before that you have with the sympathetic nervous system, you have with the aldosterone level, the renal, the kidneys. Those are the primary ones. Drugs related problems with high causes of high blood pressure can be sometimes you have some oral contraceptives like birth controls that can have, especially the one with the estrogen in it too, it can cause high blood pressure. One of the ones that I'm not sure if this is used, a lot in our native place, but we call it the MAOIs. These are most times they use it for depression, anxiety, and things like that. You see, there's sometimes if you're not careful and you're on these medications, it can cause you to have high blood pressure and actually go into a crisis, especially when you eat it with certain kind of cheese. When you take wine and tyramine foods with these high fermented foods, you got to be careful so that don't raise your blood pressure. And these can cause really bad problems. And then another one here I put here will be a secondary. So back to the primary and secondary hypertension. I have renal hypertension here. These are secondary hypertension. These kind of hypertension are the ones you have when you have like an actual disease. And these are like the one with 2 to 10% of the population. These are actually people that have renal problems, like kidney problems, thyroid problems, and you will see that under age. If you see anyone with these problems, they're usually the younger population, anywhere between like under 25. These are the people that have the secondary blood pressure problems. These people have actual diseases. The primary essential hypertension, these are the people that are over 25, 30 years old, 40 years old that have these essential hypertension problems. So, and then other ones that I have here will be the catecholamines. These are also hormones that are released into the bloodstream in response to physical and emotional stress. So when you are under stress for so long, or you're under so much physical stress, you're working 12, 20 hours a day, you're sleeping for only a few hours, you're constantly under stress, you're emotionally stressed, crying, grieving, just, being sad, being happy so much. And one literature also mentioned type A personality, because these people are always want everything done. They're very hyper. They're very, they're upbeat. Everything, they're into everything. They're on top of everything. Those type A personalities also can also have these problems too. I'm not saying that they all have it, but these are some of the causes of high blood pressure. And also, I think I already talked about this. I'm sorry, my phone is so slow, very small here. I'll talk about the endocrine, the birth control, oral contraceptives, primary aldosterone, where the aldosterone causes vasoconstriction, which causes hypertension because they're resisting the vascular resistance. And also there's a pheocytochroma. And this one is another one that can cause, it's an endocrine problem that can cause a lot of high blood pressure. A lot of times you have headaches with this one here too. So these are some things that needs to be watched out for. You have Cushing syndrome, where you have a lot of, it's another endocrine problem. It can also raise the blood pressure. People who are on long-term steroids, medication, can also have problems with controlling their blood pressure or having blood pressure, like people who have like autoimmune disease, like lupus, or what's the other one? Rheumatoid arthritis, those kind of things. They can, because they're on steroids, you have to kind of watch out for that. People with hyperthyroid disease or thyroid disease can also be having these problems. And another one here is coarctation of the aorta, which is the narrowing of the aorta. And then you see this in people with Turner syndrome. It's like a chromosome disorder. You see that, and they have this narrowing of the aorta. So a lot of times, sometimes they have problems with their blood pressure. And talking about risk factors.
Yeah.
Yes. Okay. So for risk factors, we have the race. Yes, race, the Black race, African American, about 38% of African American have this low renin salt sensitivity problem. So they hold on to salt as it is because something with the kidneys, I don't know why, but it causes these hold on to this. And renin produces it causes the blood pressure to rise, and we kind of have that. So that's one thing that we can change. So, and also family history can also cause, I guess that kind of run into the race too. Diet, we have the diet that's high in salt. And salt, if you have a lot of that in your body and it's not coming out, it's going to cause vasoconstriction, and it's going to cause increased vascular problems, and it's going to increase that blood pressure. Obesity is getting to be a thing now. A lot of people with obesity, we kind of talked about this before.
Yeah.
Somewhere, obesity is one of the risk factors for having high blood pressure. Also, sleep apnea is going to be on the rise now because they're finding out that a lot of people with sleep apnea do have high blood pressure, and so they're kind of making a connection with sleep apnea and high blood pressure. And also another thing, other things that can help to make this even worse: if you
Yeah.
have high cholesterol, if you have diabetes, glucose intolerance, one day your blood sugar is good, the
High.
next high or low, and it's
Mm-hmm.
not improving. So that has to be looked at too. Got to be careful for that. Vascular risk factors, I have the smoking.
Hmm.
Yes, smoking, diabetes, psychosocial factors. Again, when you're in gathering, drinking, eating, those kind of things. Like we talked about, the emotional stress, that's kind of psychosocial factors can cause all these um, catecholamines to come out and release this cortisol level. Cortisol level, if it's very high, can cause your blood pressure to be high also. So those are some of the risk factors for having high blood pressure.
So
And
just by being Black, you already at risk.
right. And also, not only, also other population, non-Black have blood pressure, but
Yeah.
it seems to be more prevalent amongst
Yeah.
Black people because of this renin, low renin problems that we have, and it can cause that to be a problem.
Okay. And the complications. Because
Complication,
most of the complication we know about when we
yeah.
talk about high blood pressure, we just think it's only stroke.
No, it's not just stroke.
Mm.
Stroke is one of, and when you have stroke, it's very expensive disease because, like I said, people don't know they have hypertension. Sometimes people come in 20, 30-year-old with high blood pressure. Smoking. When you smoke, that's one of the risk factors for high
Mhm.
blood pressure. Increase alcohol intake. If you have, you go to these, I want to go back to that slide again. I think I need to let me go back here. Okay, never
Okay.
mind. Never mind. I got it.
Okay.
So when we talk about, no, you can move on to the
Okay.
previous slide. Yeah. So stroke is one of the major complications because it's a lot of recovery, a lot of rehab. You have congestive heart failure where you have the fluids coming now into your lungs because your body now is kind of have worked so hard, and in a nutshell, the fluids are don't know where to go anymore, and they're not coming out. The blood pressure is high. Over time, it causes these heart problems, and you can't breathe. You can walk from here there. You're very tired. You can't tolerate any activity. You're very sleepy, and those kind of things. You can't breathe, and so those are some signs of congestive heart failure, and all the swelling in your hands and feet. And also, you have renal failure. Renal failure, which is unfortunate that people, some of the major complications over time, we call it the EGFR. If your EGFR is very low and you're holding on to potassium and is very high, you're getting confused, and it's, showing up, you're just not excreting anything. So you're going to be ending up on dialysis. So these are the major complications, and dialysis is like it's very tough because you have to be on that machine for 3 4 hours 3 times a week, and it can do some serious thing. You're just sitting there like every week you have to get up and go to dialysis. So these are the major complications, and also you have left ventricular hypertrophy, which is just the enlargement of the left ventricles because that's where it's pumping out all that blood. So after time, when you work this muscle so hard, it gets bigger, and that's what
Mhm.
happens here. So you have this enlarged left ventricles, and it's just can lead you into also this heart failure. So these are the major complications, and heart failure is pretty much, I mean, all these things are manageable with medications, but we also have to take our own initiative of taking care of them.
Thank you.
Mhm.
What we need to know.
Yes, education. So um, compliance. So we have to, first of all, it's good to have a yearly visit with your doctor at least, so they can be able to check. A lot of times, some people may be able to get these apparatus and use them at home, but going to see the doctor would be a good thing because they can be able to listen to your heart. They can be able to listen to see what's going on, check your blood pressure, and if they put you on a medication, you have to be able to take that medication. And you got to stick with it. A lot of times, some of these medications do not have good side effects, especially if they put you on a diuretic, which is one of the first drug of choice. If they put you on that, you got to go to the bathroom every 2 seconds.
Yeah.
You have to take it. But yeah, and also the diet and exercise. I always tell people if you start to exercise, people overlook exercise, but it's very good. It helps the mind, the body, and it helps keep you, you know, um, kind of active. So it helps take out the extra weight. Even they said if you lose at least 10 to 20 pounds of your weight, it helps lower your blood pressure. So weight loss is one of the good things we always say, diet and exercise. It's not mean diet, you have to go on a special diet, but you just have to watch what you eat. If you continue to go to eat all these salty foods, I know the Liberian food, I think a lot of us now are getting away with the salt, but the foods we eat, I'm not saying our food is good, but we have to limit the salt intake, especially when you're older and you're taking in all this salt, you're drinking alcohol on top of that, you're going out, you're drinking a lot during the week. On the weekends, it's another story. So you
Mm.
have to be careful when you have that, and especially with a sleep apnea, because when you are obese, when you are on, overweight, and
Mm.
you have sleep apnea, and then you have high blood pressure, that even raises your condition even higher for any like cardiovascular disease. So it's important to kind of follow the diet, no salt or low salt, and also the the protein. We have to limit the protein. If you know you have high blood pressure, eat meat and fish, but don't go overboard eating all this meat at every meal
I,
and high protein food and all of that. It just causes more problems when you have these conditions with the high blood pressure. Like we said again, high blood pressure is a silent condition. You don't know it until it's really bad. Sometimes patients come in, you have nothing to do but to send them straight to the ER because you didn't even want to look at them. Because the time you take to look at them, you just call 911 and just take them right to the hospital because it's very high. You cannot be having people sitting around with high blood pressure and then they fall down and then they have a stroke. So and then it's God has been great, good, because sometimes people have high blood pressure and you look at them, you be like, oh my God, how is this person still standing here? You
yeah.
know? So yes. So you just have to, it's a silent thing. A lot of people don't have that headaches. Some people maybe wanted they will have that. Oh, I really can see. My eyes are kind of blurry today, or I'm a little dizzy, So those are things to watch out for. If you feel dizzy, if you feel like you can't really see, you lost your vision, which is really bad, like if you just suddenly cannot see, that's a problem. So these things have to be monitored at home, checking them, all the time, making sure you're okay. Go see your doctor at least once or twice a year. And if you have they they give you the medication, you need to take it. And
Yep.
we also have the home blood pressure monitoring. You need to do that if you have someone that can check your blood pressure at home. And I always like to do the manual blood pressure because you can actually listen and actually hear, each everything. So I like that. So you can do your. I'm not saying that the thing, the cough is not good, but it's also nice to listen to the actual blood pressure. And then um, for recommendations for people with high blood pressure, you have the low sodium diet. It's the 2 gram sodium diet. So you have to look at the food you eat. If you're in country where they don't have labels on the food, just know once you cook that food, don't add so much salt to it that is to your taste.
Mm.
Just
This
realize,
is what.
yes, you're cooking for other people too. If you're cooking for yourself, you don't have high blood pressure, that's fine. But if you're cooking for people who are especially elderly or in their 40s and 50s, you have to be careful too, because all this salt can actually, you can hold on to the salt, and as you hold on to the salt, it brings the pressure up, and it's not good. A lot of times you see people with their legs are kind of swollen.
Yeah.
It just shows that sometimes it could be from just blood pressure being too high, and you need to just take all this extra fluid out. And we also talk about the weight reduction. We talk about at least losing 10 to 20 pounds of your body weight. If you lose that weight, your blood pressure will come down some. I'm not saying all the time. I'm not saying everybody that is overweight has blood pressure problem.
That's right.
No, it's not, because some people are very overweight and they have good blood pressures, and some people are very thin and they have high blood pressure. So it's not the matter, but it's just saying these are some of the risk factors for having high blood pressure. So weight reduction is one of the ways. Limit the alcohol. Again, for women, they said 1 drink. For men, they said 2 drink. But mind you, if you start drinking every day, these are everything adding up with that roasted meat and
Mm.
the
I know, right?
and the fried plantain and the cassava. So all those things kind of add up, and it's just a lot of extra uh, um, salt in there. Also, quitting smoking is one of the big things you can do. They recommend you quit smoking, which is one of the best things you can do for yourself, for your lungs. and because it just also all of these just causes extra stress on the vascular bed. Also, we recommend an exercise program. Doesn't mean you have to join, the gym or something, but you have to commit yourself to at least, they said 30 minutes a day of, vigorous exercise. So mowing your lawn, taking a walk, walking a dog, going around, walking at least to break a sweat, not
Mhm.
just sitting there. So you got to get involved in these exercise programs. And one of the treatment that some of the treatment we use for um,
High blood
high
pressure.
blood pressure, the number one medication is a diuretic. That's the first medication we use for treating high blood pressure. And a lot of times it's called a thiazide diuretic. And this is just if you haven't taken this medicine, I've seen this medicine work on people. You will urinate, especially if you haven't taken this medicine for before. So I tell people take it in the morning because in the evening you want to try to sleep. So take it in the morning, best thing in the morning, and try to take it. Eat your banana because sometimes it can cause you to lose potassium. And I say here, work your way up. Please don't. So all these medications are added medications that if your blood pressure is not controlled, we kind of add it on there. The ACE inhibitors. Okay, these ACE inhibitors, we talk about those renin that we have in our bodies. So these inhibitors, they kind of block that so you don't have a lot of them so that they can be excreted out of the system. So
Mhm.
that's what those ACE inhibitors are. And then we have the other one they call the ARBs. These are also another alternative to the ACE inhibitors. We can use that too to treat high blood pressure. We can also use the calcium channel blocker to use. So they have a lot of medications to treat high blood pressure, but the diuretics are the first choice to use. And if not, they kind of work that way. We have the beta blockers to use, and we also have those like far extra ones like the clonidine we use for emergencies situation. Uh,
Mhm.
yes. And then I have here my special population, which will be the pregnant woman. The
Yeah.
pregnant woman, anybody who's over, if you're greater than 20 weeks and you start having high blood pressure, we really try to prevent that because if it's not treated, it can cause you harm, it can cause your baby harm. So we like to take care of that to prevent pre-eclampsia. That's when you are having these high blood pressure with protein in your urine. We don't want it to progress to what we call eclampsia, where you start having really high blood pressure and you start having seizures and things like that because it's not good and it's not safe for you or your baby. So we really have to get on top of that. We also have patients with diabetes because if you have diabetes and you have high blood pressure, that's an added one. So we
Mhm.
like to treat these patients because if you have this over time, diabetes, it has this neuropathy on your kidneys. It can cause kidney neuropathy. So your kidneys don't act really well. So you really want to be on top of that with diabetes. And the big one is heart failure. These patients will need to be really be followed by a cardiology or heart doctor because these can cause a lot of problems and they need need to be watched. The activity level, sometimes some people have you know a lot of things. So swelling in their hands, congested heart failure. They can't do anything. They can't walk from here there. They're very, exhausted every time. They can't really breathe well. So those are things they have to watch out for and kind of stay with this medication. A lot of times with these patients, we do a lot of the loop diuretics, the Lasix. We do that a lot to kind of take out that extra fluid from around the lungs. So pretty much, this is not the best way to go for this high blood pressure. But at least the biggest thing to take away from this is know that high blood pressure is a silent killer.
Mhm.
Yeah, it is. A lot of times you see it in the young people, and it's really sad. And it's as people say, oh, I don't want to take my medication because of the side effects. well, you don't want to end up with a stroke either.
I know.
So
Worse than that.
we have to stress that. Yeah.
All right, someone was asking a question here. What are 20 to 25-year-old women can have hypertension?
Oh,
And
yes.
I was looking at, doing some research, and I found out that they have young children
Oh, yes.
with high blood pressure.
Young children with high blood pressure, these are the secondary causes. So these are the children you want to look at. You want to check their thyroid levels. You want to check their kidneys to make sure their kidneys don't have any stenosis to it. You want to make sure they don't have any infection, because sometimes when you have infections, like when you have infections on your kidneys, it can affect your kidneys from, like, it can cause scar tissue also, and you can have kidney disease. So yes, people around 20 to 25-year-olds do have high blood pressure. Absolutely. And these are the people you want to kind of follow to make sure. Yeah.
Okay, some of the questions they ask here are questions that we already talked about. What are the symptoms of high blood pressure? And
Okay. So high blood pressure, like we said, a lot of times it does not have symptoms. You may have the headache. You may have the vision problem. But a lot of times people walk around, they don't know they have high blood pressure. But you have the headaches. And a lot of times, which is very sad, like I said, you have people with having strokes, and these little strokes, lacunar strokes and those things. So yes.
the person want to know whether getting angry can give you high blood pressure.
Yes. So we talk about that. Who's MD Sumo Suman? Okay. Yes. So when you're angry, right, you have these epinephrines and norepinephrines. Yes, you do have. It can cause, if you're continuously angry and
Yeah.
you are continuously in a hyperactive state, you can have high blood pressure. Yes. So it's nice to be chill, which is, is yes, angry people do have being angry does can also add up to you having high blood pressure. Mm-hmm. Yeah.
And
So
let me. I'm looking at some of our questions here because most of them are stuff that we have said.
okay.
You have said, yeah. Okay, let's see this one. The person said, um,
My grandma is 75 years old. Will she be affected by
hypertension at this
hypertension
age.
at this age? A lot of times, when the grandparents or when the elderly have hypertension, it's kind of like isolated blood pressure problems. Yes, they can have high blood pressure problems, so we do give them medications to help with that. And one of them we usually give will be the thiazide diuretic, because it helps with the bones, and also, it helps with the bones. So we do that. So yes.
Okay. And the person want to know what they should do. Yes, what you should do.
Okay, so I'm not a doctor, but I'm a nurse practitioner. But anyway,
Go to
what do
your
we do
doctor.
if we have hypertension? What you can do is, to be diagnosed, you have to have blood pressure that's elevated more than once. So if you come to the doctor's office today, you have your blood pressure taken is high. Okay, go back. Maybe it's just high from you being in the hospital. And then we come back again after a couple weeks, check it again. If it's still high, then we want to give you at this point, like the home monitoring, where it's on you and you kind of do your blood pressure. It's called the ambulatory blood pressure monitoring. You kind of do that, and then if you do have, you bring the readings and we check the readings, and then if it's low, if you are home and you don't have high blood pressure, then that's fine. But if it's high while you're doing that ambulatory blood pressure monitoring, then it's considered. You do it, and then you start with a with a thiazide diuretic.
Okay, the person want to know about the systolic and diastolic.
Systolic blood pressure, diastolic blood pressure, MDZA. Okay, systolic blood pressure is pretty much the it's blood pressure that is kind of high. It's like the top number that needs to be below 120. And the diastolic is the force against in the ventricles that is going to be pushed against, and it's at least 80.
Thank you.
Mhm.
Well, time is fast spent. It has been a great time here learning all about high blood pressure. The broadcast is almost over, but you can still send your texts, your comments, and everything, and we will, get back to you through the text messages. I want to say thank you to our guest tonight, not our guest, but our teacher tonight, our professor,
No.
us on high blood pressure. Yeah, but it was a good discussion, and we learned a lot. So this is not a hospital, and we are not, your primary doctors. We are not doctors. There are different fields in the health area. So this information they are provided so you can be on your guide, and so you can, when you go for checkup and when you go to your doctors, you can ask the right questions and you can seek help. If for any reasons you have some symptoms and you notice something strange about your body, you need to ask the questions. So that's the reason why we are here, to provide the information to, create the awareness. Once again, I want to say thank you for watching. Thank you for being part of this broadcast. I want to give the opportunity to Thelma to say her last word before we close up tonight.
I just want to say thank you all for watching, and take care of your health. Blood pressure is something that can be controlled. So if, even if you don't have it, but at least if you start checking and doing your own log of your blood pressure, you can know where you stand. Normal blood pressure should be 120 over 80. If you're getting any number higher than that, more than once, twice, I think it's something that you need to bring to your doctor and ask if you need to be on the medication, especially if you're much younger, like under 25. That's something that needs to be taken care of, so that your doctor knows and they can work up. Because a lot of times, by the time you come to the hospital or you come to the clinic, you've had this problem for a long time already. So the earlier, the better. Okay.
Thank
And
you so
again,
much.
remember that blood pressure is a silent killer. I used to be, way back when, I used to run a lot. I used to run track back in Virginia, not professionally. I did it on my own. And one afternoon, I went to the doctor. I think I went for a physical, and they said, "Oh, your blood pressure is high." I'm like, "What?" I was like, "Oh no, I can't have high blood pressure." And I had that thing checked so many times, and it was okay, but it was just something that, and you have to be careful of. Another thing is, when you smoke, before you go to your doctor's office, make sure you don't smoke before you go there, because it can also raise the blood pressure. Before you do your blood pressure, you want to sit down for at least 10-15 minutes, let your body relax, and your body can settle down before you start taking the blood pressure. Because sometimes when you're running on the bus or you're running to your doctor's office, your blood, you're kind of moving around, so you're kind of active at that time. So
Yeah.
you have to sit down and be relaxed to take this blood pressure so that it can be okay. And if it's high at that time, we can check it again. But definitely, if it's high more than once, more than twice, it's time to be on something.
Yep.
Thank you all so much.
Amen. Amen. Want to say thank you tonight to Selma, and want to say thank you to our viewers tonight. And for those of you out there that are not well, I want you to know that God is still in the business of healing. He is our healer. The word of God tells us so, that He is the healer. So tonight, wherever you are, the word of God says in Jeremiah 17 and verse 14, heal me, O Lord, and I shall be healed. Save me, and I shall be saved, for thou art my praise. Isaiah 41 verse 10 says, for fear thou not, for I am with thee. Be not dismayed, for I am thy God. I will strengthen thee, yea, I will help thee, yea, I will uphold thee with the right hand of my righteousness. So wherever you are, God is still at work, and he's still the healing. He's still healing. He's still the healer. Hallelujah. So God bless you tonight. By the stripes of Jesus, you are healed. Those of you that are going through this condition, high blood pressure, by his stripes, you are healed. Continue taking your medication. There's nothing wrong with taking your medication if you are Christian. You know, sometimes we have all kinds of ideas about Christianity and medication and doctors, but the doctor treats, God heals. Know that God is the healer. So do what your doctor tell you to do and continue in prayers. The Lord is with you, and by his stripes you are healed. Those of you that are going through some medical condition or the other, whether it's COVID-19, you are hospitalized, whatever the sickness, cancer, you name it. We declare tonight you are healed. Declare healing in your body and declare healing in your home. Declare healing in every situation concerning your life. In the name of Jesus. God bless you tonight. Thank you for joining us. And we will be here next Thursday, the same time, for Health Matters. Your health matters. God bless you.
Thank you. Amen.
Thank you so much.